Hi, everyone, and welcome to another episode of Chats with Your Advocate, where health literacy meets real life. I'm Tiffany James, your nurse practitioner, board certified patient advocate, and owner of Divine Wellness Partners. I'm excited today for this important conversation. Today, we're going to be kicking off National Breastfeeding Month and World Breastfeeding Week. And we're going to have a chat today on breastfeeding as public health and a community conversation. So, we're going to be focusing on building a culture of support for every breastfeeding journey. Now, as usual with my chats, we want to talk about a little disclaimer. This conversation is for educational purposes only. It is not meant to substitute medical advice. Always check with your healthcare provider before starting anything that we discuss or for any medical concerns or questions. Now, I'm joined today by Miss Mijah Robinson. She is a doula, lactation advocate, and prenatal massage therapist. She serves families here in the Space Coast and beyond. Mijah, welcome. I'm so honored to have you here.
Thank you for having me. I'm so happy to be here.
Absolutely. So tell us a little bit about you, how you got started, and what you're doing today.
Yeah, so a little about me. Um, Fresh out of high school, went to college for a bit, and then I actually joined the United States Air Force. I served as a behavioral health technician, loved my time there, really got to like work in the medical setting, and I was like, this is definitely my space. After I got out, I went to massage therapy school. And when I was there, I was like, give me all the prenatal girlies. Like I just want to massage the pregnant women. And my instructor, she actually like spoke life into me. She's like, you should like think about becoming a doula. And I never really put that into anything until 2 years later. And I was like, you know what? After I had my second baby, I hired a doula and I was like, this is phenomenal. Like I want to do this work. Um, and then at that same time, when I was pregnant with that second child, I actually went into WIC, which is Women, Infant, Children. So they specialize in infant nutrition, access to artificial breast milk if needed, and also education for breastfeeding. And that's where I actually applied for that position. I became a peer counselor. Then I got my credentials with the military lactation community and became a lactation counselor. So everything just kind of came together as far as me being in the birth worker space. So yeah, that's kind of how it started, and it's just been rolling ever since.
That is beautiful. Thank you so much for sharing. You're just a wealth of knowledge, and I know an inspiration for so many women. I'm done having kids, but listen, if I was gonna have another baby, I'd be like, call Mijah. I need to talk to Mijah. I need her to be my doula right away. So,
Yes. No, I love that. I love working in this space. I love our community, and I just want everybody to have as best outcomes that we can. You know what I mean?
absolutely, absolutely. And it's just so necessary, And so part of the reason why we do these chats is to just make sure we empower not just women, but all viewers to have that knowledge, to know the questions to ask, to know what to do, right? So
Hmm.
again, thank you again. So let's talk about breastfeeding as a public health and
Yeah.
normalizing the conversation within the community. So what does that mean to you as a doula and lactation advocate and consultant? What does that mean?
Yeah. So breastfeeding is a public health, just in general, right? So years and years ago, generations ago, we would breastfeeding as the primary, right? So even our histories as far as Black women, how we were nursing other people's children, things like that's something that we have done for generations. And somewhere along the lines in like the 40s and 50s, that completely shifted. They started creating the scientific formula for artificial breast milk. And I use that term very specifically, not trying to say formula. I prefer to say breast milk substitute, human milk substitute, or artificial breast milk, because that is what it is. Breast milk is the optimal milk for our children, for human babies. And that has been backed by the World Health Organization, by UNICEF, by the CDC. So that's why it is a public health conversation, right?
Absolutely.
So yeah, in the 1940s and 50s, that's where it started shifting. They created that scientific formula for our breast milk. And then around 1970s, it completely dropped. We had less than 25% of people initiating breastfeeding at all. Then things started changing around the 80s, 90s. And we have started seeing great strides, especially with the resources from WIC. They are hitting 50 years, I believe.
Wow.
Um, Yeah, it's amazing. So women, infant, children, like I was talking about that previously, I loved working for that community, that company,
Yeah,
for the Florida Health Department because they do really advocate for breastfeeding first. And I just wish that was something that we can prioritize in hospital settings, in
yeah,
OB settings, pediatrician offices, you know,
absolutely.
because a lot of times those pediatrician offices and even some of those hospitals they're still showing like photographs and things like that of formula. They're
Hmm.
still marketing formula or infant or artificial breast milk, you know?
Yeah,
Um, Whereas we should have photos of beautiful families breastfeeding and people
right.
doing twin tandem feeding, things like that. So
Yeah.
it's already shifted in our minds, even with TV and social media and things like that, of just popping that bottle and feeding that baby
Hmm.
that artificial breast milk.
Absolutely.
So it's definitely a public health issue, concern, something that we
Oh,
need to speak on. I'm
absolutely.
happy to be here to do this.
Yeah, 100% agree. And I remember just listening to what you're talking about. Having my oldest son, he's 18 now. Um,
Hmm.
we had some latching issues, and I was a young mom. And the first thing they did, they brought me a bottle of formula. They were like, "Here,
Hmm.
he's hungry, feed him." You
Yeah.
know, I I didn't know the questions to ask. I didn't know, what to do at that time. It was 18 years ago. I
Hmm.
overwhelmed, all the questions. I'm like, what do I do? Crying baby, feed him. I don't know. So put
Yeah.
the bottle in his mouth, right? And then never looked back, So
Yeah.
in child I was able to breastfeed him, but just knowing more the questions to ask. So and talking about that, how can we prepare moms for breastfeeding? How can we prepare them for lactation prior, to the baby arriving? These types of conversations. What can we do?
Yes, and I'm so glad you said that prior to baby arriving. That's where we're really focusing on communicating with families and mothers, those that are planning to breastfeed. That's where we want to start. So we've got doulas, lactation counselors, lactation consultants. Again, that WIC program, there's peer counselors. We want to get that prenatal education put out on the forefront, especially for myself in the birth worker space. Whenever I have a client come on, I'm always asking like, how have you thought about how you want to feed your baby? And then
Hmm.
we get into that conversation. Oh, I'm going to try to breastfeed. If it doesn't work, it doesn't work. Okay, well, let's unpack that, right?
Right.
Because there's so many different facets on why it wouldn't work. Biologically, that's what we're meant to do. Like our bodies are able to do this, unless there's some other circumstance, things
Right.
like mastectomies or something like that, obviously, or
Hmm.
the breast tissue didn't fully develop. Of course, we've got that. But majority of people that do want to breastfeed, they shouldn't have any of those constituents, I guess. Um, the biggest fears or reasons why people would stop breastfeeding, and this is statistical as well. I gave you the website so
Yeah,
you can put it in the notes.
absolutely.
But not enough. Yes, but not enough breast milk. My baby wasn't satisfied. I was put on medication, so I stopped breastfeeding. I had difficulty latching, or it was too painful. And all of those different subjects are something that a lactation counselor or lactation consultant would address and really
Yes.
help them move forward with their breastfeeding journey. Because again, it is biological
Yeah,
and it just needs that support, essentially, that
absolutely.
support to make it happen.
Absolutely. Yeah, that's amazing. It is. And it's so true. So true. So
Hmm.
when we talk about long-term breastfeeding support, we talked about the World Health Organization and their recommendations and some of the things we looked at in the references you sent, recommending at least 6 months of breastfeeding and continued support beyond that. Um, why do you think that after that 6 month mark, why do you think that some of the families may drop off, or what challenges happen after that point?
Yeah, so the biggest challenge we notice is, of course, going back to work. That usually happens 6 weeks or potentially earlier.
Mm.
So we do really need to support moms with that and families when it comes to the Pump Act,
Okay.
which the legislative did push. So now employers are required to provide that time, space, accommodation for families to breastfeed, to pump for their babies, which is amazing. So I'm super happy that like that put in motion. Um, but that's a big thing for families is breast pumping for the breast milk. And then also the 6 month mark, that's when we start introducing solids to our babies.
Okay.
So I think that's where the disconnect is. People are assuming, oh, baby's starting food but also your baby still needs that milk, whether it's artificial breast milk or breast milk, for that first year of life. We don't just introduce cow milk to them. So we would like for families to give that breast milk long term, which is the first year given, but up to 2 years. Some families go even beyond that because of the biological markers that are in that breast milk. So the
Mm-hmm.
different antibodies that it creates, obviously the vitamins, minerals, proteins, things that we cannot replicate in formula, the breast milk has. So even if your baby gets sick, just by putting them skin to skin, your body's going to regulate their temperature. Them latching on their saliva will literally tell your body what materials your baby needs. Yeah.
That's beautiful. That is a divine science right there. That is
It
amazing.
is.
That is a
Yes.
beautiful thing. Absolutely. So, what can we do as a society to create a space for long-term support? Because we're talking statistics here, a year, 2 years plus with breastfeeding. How can we support that? What can we do as
Hmm. So the biggest is normalizing it, talking about it, bringing it up. Um, a lot of times when I have my doula clients or even my lactation clients, I ask them, ask your families, ask your mom, did she breastfeed you? And some have no idea. They're like, that's not a topic I brought up. And I love having the partners in the space. I'm like, Dad, have you been breastfed? Do you know anything about it? And they're like, you know what? Or some are like, yes, my mom breastfed me 1 year or 2 years, or I got breastfed 6 weeks. My brother got breastfed 2 years. He's so smart, whatever it is
yeah.
that they compute breastfeeding to. But it is just a great topic to speak upon. So I always want them to ask your family, ask your friends. Let's bring this conversation as something normal. Obviously, normalizing people breastfeeding. You see a mom feeding her baby, like cheer her on, like, you go, girl.
Mhm.
Just those little tidbits. Children, I breastfeed often, whether it's at church or at the park or wherever I'm at, just to help normalize it, destigmatize it. And children, they don't care.
No.
They're just like, they'll walk up and be like, oh, what are you doing?
Uh,
Wow. You know what I mean?
yeah.
That's so cool. Like, they're not associating it with anything
Right.
weird or uncomfortable. So a lot of times it's normalizing it, talking about it, peer support groups, so having that community for you. We have the Space Coast Breastfeeding Coalition. It's a phenomenal group of lactation providers, pediatric dentists, just different community partners
Beautiful. Yeah.
uplifting breastfeeding on the Space Coast. So
Nice. Nice.
yeah, so different support groups like that. We've got our event coming up this
Yeah.
month. So yeah,
Absolutely.
just things like that.
Good, good, good. And so, talking specifically about the Space Coast, statistically, I know we talked about some of the local statistics. Let's talk about that. And what do the numbers actually mean in terms of the support we need here locally?
Yeah. So I was doing a lot of research trying to see when the shift changes. It is on the Florida Health Statistics website. All I could find was the percentage of families initiating breastfeeding, which I was actually pleasantly surprised. It is over 80%, and it
That,
is actually a little bit above the Florida average. So initiating breastfeeding is great, but that's just breastfeeding in the hospital and they get discharged. And what happened then? Are we still breastfeeding? Are we still breastfeeding at 6 months, a year, 2 years? So we didn't have much statistics that I can see on that, unfortunately. But even just working in that WIC space, I know it's a selective group of individuals, but we were noticing a lot of just transitions and shifts, and it wasn't at that 6 month mark. It was again at that 4 to 6 week time frame when they start going back to work.
gotcha. Okay.
So yeah, I couldn't
Yeah.
find some set statistics, but I was
Yeah.
happy with the initiation, but still in that gray area of, okay, where are we at long term or even 6 weeks
Yeah. And to your
postnatal?
point, I think it just means we need to have more conversations about it. Let's normalize
Mm-hmm.
what's working, what's not, what can we do, to make it
Yes.
a common conversation in the community. So that's absolutely right. And
Mm-hmm.
so I know we opened up talking about August, it's breastfeeding month, and we have Worldwide Breastfeeding Week coming up. Let's talk about all the different things that are going on in this month. I want to hear about it.
Whew.
Tell me.
I love this month. Aside from being my birthday month, like breastfeeding month
Woo-hoo.
is everything. So, World Breastfeeding Week is from August 1st to August 7th, but here in America, we do have a nationwide World or National Breastfeeding Month. So each week is designated to different individuals. August 1st through 7th is again the World Breastfeeding Week, but it's also WIC Breastfeeding Week. Then we've got Indigenous Milk Medicine Week, where we highlight and uplift Indigenous individuals. We've got Asian American, Native Hawaiian, Pacific Islander Breastfeeding Week. They've got their own theme as well. We've got Black Breastfeeding Week, which love that. Um, the theme for this one is roots on the ground. So we've got that. And then we also have Military Lactation Week. And I feel like I'm missing one, but I feel like that might be all of them. Oh, we just
Oh,
added one, actually. I'm sorry. The deaf and hard of hearing that just got added this year. So
nice.
we've got a lot going on. If you want to follow, or if you guys watching want to follow any of their Facebooks, so deaf and hard of hearing, Black Breastfeeding Week, Indigenous Milk Medicine, AA and HPI breastfeeding, and then of course the National WIC Association. So those 5 different channels. They all have different segments going on, whether it's free webinars or community events, things like that. Here
Okay.
locally on the Space Coast, however, we do have this 321 latch, which is our biggest event. We all latch at the same time, those that are still nursing their babies. But we've got multiple vendors, over 20 vendors, selling products, giving free giveaways, raffles, tummy time, circle time, all those things. And that's
Beautiful.
August 1st.
August 1st. Beautiful,
Yes.
beautiful. Yes, ma'am. And so if people want to follow you, if they want to find you, how can they get a hold of you? How can they see what you're doing? Follow this beautiful mission that you have.
Yeah, so I'm on Facebook, Instagram at Healing Hands by Mijah. That's Mijah, or my name. And then you can also go to my website. It's again healinghandsbymijah.com. You can email me. I reach out or follow back on my DMs. So either way, that's how you can get in contact with me and see what I'm up to.
Wonderful. Well, Mijah,
Yeah.
thank you so much for sharing your expertise and just your heart with us today. We really appreciate it. Please, everybody that's viewing, tap in, like and subscribe here. Follow Miss Mijah, follow Divine Wellness Partners. We have more coming up. And again, thank you so much, Mijah. We really appreciate everything that you're doing. We really do.
No, thank you for having me, Miss Tiffany. This was a phenomenal topic,
Of
and I
course.
appreciate you highlighting it.
Yes, absolutely. And just to point out, as with all of my chats, I always like to include resources in the YouTube description because I do believe in taking that health literacy and empowering people doing your research beyond the chat. So all of the wonderful resources and links that Miss Mijah was talking about today will be in that description. Okay. All righty. Well, thank you all so much for watching. And again, one more time, thank you for Miss Mijah. We appreciate you.
Thank you for having me. Y'all have a great day.